So I'm going to go through what to expect during a day of surgery. We start at 7:30 in the morning, so we ask our patients to be in at 7:30, to eat something for breakfast, to wear comfortable clothing. And once they're here, we will go over the plan, draw their hairline in, make sure that everyone's on the same page in terms of expectations. And then we will trim the hair, the back, the top, whatever we had pre-planned in terms of the procedure. Once that's done, what I typically do is I'll make the sites. The sites are where the hairs are going to go, where the grafts are going to go. What that entails is anesthetizing the scalp. If we're working on the hairline and the frontal scalp, then these areas will be anesthetized. I use a very tiny needle with a combination of anesthetic medications to numb everything up. The injections can be a little uncomfortable going in, but once the medications are in, you won't be feeling anything. And then I make all the sites, whatever the plan was, 1,000, 2,000 grafts. And usually that procedure or that part of the procedure takes about an hour to an hour and a half to complete. Once that's done, we start with the harvesting process. We take the patient to the robotic room, get them comfortable in the robotic chair, and then we anesthetize the back. So I use a similar method, tiny needle with anesthetic to numb up the back of the scalp, make sure everything is numb before we start. Again, the injections can be a little uncomfortable going in, but once the anesthetic is in, patients don't feel anything anymore. And then we start with the harvesting. Since I've made all the sites first, usually we can start implanting while the robotic part of the procedure is also going. So this level of multitasking helps to facilitate the process and complete the procedure in a shorter period of time. Once the robotic part of the procedure is done, then we have a little lunch break. We'll order some food in for our patients and then complete the implantation process. It is a long day. It can be anywhere from 6 to 8 hours, and that's why we only do one procedure a day. And by the end of the day, we dress the patients, put antibiotic ointment on them, and they go home in a bandana, and we invite them back the next day for a hair wash, for their post-op visit, and show them how to take care of their scalps afterwards.